Some experts suggest that men are much more likely to die from coronavirus. But why? They say this trend has been replicated in all nations, but scientists cannot yet fathom the cause. Well, it's been well publicized that COVID-19 discriminates by age and by underlying health conditions, but it has become increasingly apparent that it also discriminates by gender, with men more likely to test positive and more likely to die from the disease. The trend was first seen in China, where one analysis found a fatality rate of 2.8% in men compared with 1.7% in women. Since then, the pattern has been mirrored in France, Germany, Iran, Italy, South Korea and Spain. On finding a cure or a treatment and a possible vaccine, scientists around the world are racing against time. Now, currently, pharmaceutical and biotech companies are running a race against time to successfully develop vaccines to combat this disease. And given the alarming levels of spread and severity, some approved drug or pipeline candidates are being tested to see if they are effective in treating the infected patients. For more on this story, we joined via Skype by the director of the Desmond Tutu HIV Centre at the University of Cape Town, Professor Linda-Gail Bekker. Professor, a very good evening to you. Thanks for joining us. Welcome to the Globe.
Hi, Simpiwe. Real pleasure to be with you.
Now, before we get to the bolts and nuts as to why this coronavirus apparently attacks men over women, I think we should rather start the conversation by differentiating between, a vaccine and a cure. I do understand that vaccine is something that you take or as an injection before being exposed to a particular disease, and then a cure is when you are completely rid of this particular disease. So are scientists trying to find a cure or a vaccine?
I think both, Simpiwe. So first of all, we really want to have a vaccine so that we can vaccinate large numbers of population at risk of infection to stop them getting infection. And then obviously those who do get infected, we want to be able to give them effective treatment. And so we need to do both. Because the virus is already circulating, we want to stop and protect those who are at risk but not yet infected. And for those who are infected and become diseased, we need better treatments to be able to reduce the severity of their disease and prevent death.
What is the process, though, of developing a cure or a vaccine? Because there have been theories doing the rounds that scientists are using bats, for instance, to find a cure or a vaccine to coronavirus. So what is that correlation between human biology and that of animals?
Well, we often have to first test our new ideas or agents in animals. So that, there is always pre-human testing, first of all, to figure out, does this product that may become a vaccine, does it hold water? Does it have any efficacy at all? The next step is to say, is it safe in humans? Can we actually use it in humans? And the listeners may be aware that those trials have already started overseas, and we already have candidate vaccines that are being tested in humans. We call those phase 1 studies. They're in small numbers, and it is just to make sure that they don't cause harm. The second phase is then to say, does this vaccine actually prevent viral infection? And hopefully those trials will be coming soon. But we have to go through these phases very methodically to be sure, first of all, that we have a candidate that has promise. Secondly, is it safe in humans? And then thirdly, is it effective in humans? And each of those steps need to work before a licensed vaccine is available.
Now, stats and figures have shown that men are more likely to die from coronavirus, and has been seen already in China and some European states. Why is this, though? Why is this the case? Does it have to do with the kind of lifestyle that men live? Experts do believe that the sex imbalance relates to the chronic alcohol use and smoking among men.
Yeah, I think that, when we see these kind of statistics, and I think they really are playing out, initially the signals seem to be that those who are older and have comorbid conditions, so diabetes, lung conditions, might be at more risk of severe disease. When data is looked at by sex, it does look like there is also this male factor. And in some countries, as much as twice as many men are having severe disease and succumbing to the infection. I think immediately we think there must be behavioral and there must be biological reasons. And certainly I think time will tell. I don't think any of us yet have answers, but some of the ideas that come to mind are particularly maybe men are more likely to be smokers, more likely to have lung disease. Perhaps they are less likely to step forward early with their infection. And, maybe they're in positions where they might be more exposed to the virus. So these are some of the ideas that might be out there. But definitely, I think the statistics are holding out that we are seeing more disease in men. So I think, what we can take from this is maybe not only do we have to be more careful with our grandmothers in terms of exposure, but even more careful with our grandfathers, and think carefully about older men in communities.
Yeah, and having said that, why do older people in particular need more protection, and why are children less likely to be at risk?
Well, I think it's not necessarily true that children are less likely to be at risk. So we've got to separate infection from disease. So the data around the world shows that a good number of young people are becoming infected but are more likely to be asymptomatic. So I think it's very important we bust that myth that young people are somehow immune to this infection. That is not true. We are seeing infection in young people, but luckily and fortunately, unlike perhaps HIV, we're not seeing disease occurring in young people. We are seeing disease in older people, and I think this is just because the virus in its severity favors people who have other conditions, and we know that it's older people who are more likely to have lung conditions, to have other problems, and therefore perhaps to get more severe disease. Yeah. And it's those individuals who we see dying, unfortunately, of the infection.
Yeah. And Professor, is it true that coronavirus proliferates and strives in warmer season or in warmer weathers?
No, in fact, normally what we understand from these kinds of droplet infections that are passed from one to the other at this time of the year tends to be actually in the flu season or the winter months, perhaps because windows are less likely to be open, people are more likely to be huddled together, and we know that there's far more respiratory type illnesses, and it's usually in those kinds of environments that these kinds of infections are more transmitted.
Now, should we be worried about the infection rates in South Africa? The trend hasn't been so impressive, so to speak. So should we be worried about, the number of people getting infected on a single basis or on every single day?
Absolutely. I think we all need to, I think we just have to, look north, see what's happening in Italy and United States, in Europe. We have to take this seriously. This is a huge global threat. I think South Africa's really doing a fantastic job of paying attention, trying to think of every possibility. And I think the best thing we can do is listen to health officials, to the scientists that are guiding us, and absolutely take this pandemic seriously.
And more importantly, I think it's very important that we re-emphasize the use of masks and gloves. What is your position with regards to those?
Well, I think, and I heard Minister say earlier, it's very, very important that the right protective equipment is available to our health care workers. So it's important that those specially designed medical protection, masks, gloves, coverings, aprons, etc., are safeguarded and kept for healthcare workers so that they can be protected from the virus. But I think the world is coming round to recognize that individuals individuals who go out from their lockdown positions, either to shop or perhaps they are providing essential services of some sort, that perhaps in those settings, having some kind of mask or covering may reduce harm and reduce the amount of droplets, if you like, out there. It is important, though, that people should recognize that doesn't render them invincible to the virus. So they've still got to take the precautions of hand washing, physical distancing, etc. But I think now the WHO, the CDC, and other institutions, and I heard also from our own health department, some recommendations that people may adopt and use their own masks. And I think the internet is rife with all kinds of ideas of how to make them and how to use them. I think this is another way that we can reduce the amount of harm of droplets out there around to be spread around in the public. When it comes to gloves, we have to remember that when gloves are used all day, they become like hands. And so those droplets can also stick to gloves. So people need to be aware again that wearing, some gardening gloves or whatever out when they're shopping doesn't necessarily make them invincible to the virus. And so those same principles of physical distancing, of good hygiene, and of making sure that, we isolate ourselves from others who may be ill, or if we ourselves have symptoms, these are all very important infection control principles that each one of us, every South African, has to think about and maintain in their lives in the next few months.
So you suggest that constant washing and sanitizing of hands is much better than wearing gloves?
I think probably in terms of the public at large, I think that probably is the case. I think hands are easier to wash and are more likely to be washed than gloves. However, obviously, we need gloves to be supplied to our healthcare workers, and it's very important that gloves are available for those people conducting tests and managing patients in hospitals.
Professor Linda-Gail Bekker, Director of the Desmond Tutu HIV Centre at the University of Cape Town, joining us via Skype. Thank you so much for your time. Much appreciated.
Real pleasure. Thank you for having me.